Hello, I'm Dr. Kevin Ashbran from Newport Harbor Animal Hospital, and today we're going to talk a little bit about endoscopic procedures for your pet dog. Hopefully this will help answer some questions that you might have. My assistant Brittany will be asking commonly asked questions or frequently asked questions, and then I'll try to best answer them as I can. You can see we're standing here in our surgical suite, and here's what our endoscopic unit looks like. And basically, endoscopes are a tool that we use to visualize the small intestine. So this is what it looks like. It's hooked up to a monitor and a camera so we can see, and that's sort of the very basic part of it.
Dr. Ashbran, when are endoscopies used to treat dogs?
Multiple cases. I think one of the times we use it most would be if dogs have swallowed something, a foreign object, and it is lodged in their stomach, and we can see that on other imaging, modalities like X-rays. We see that object there, and it is something that we think we can grab with an endoscope. The scope allows us to put pinchers or baskets down and grab those objects. So sometimes we can go in endoscopically and actually get out foreign objects out of stomachs without requiring surgery. So that it's obviously less invasive for your pet, obviously better. So that would be the first sort of obvious thing we use it for. The second is a little more in depth. Dogs and cats, but dogs can have some complex gastrointestinal diseases where that need diagnosing, that we sometimes cannot diagnose with other forms like X-rays or ultrasound or blood tests. So sometimes we actually have to visualize the small intestine. So again, the scope is put down the throat. It goes down the throat and the esophagus into the stomach and into the first part of the small intestine, or even the large intestine going up in the colon. We cannot reach all of the intestine, but we're able to visualize the inside of that intestine. We're able to look for abnormalities, and then also allows us to take biopsies of that intestinal wall, and allows us to then help diagnose some diseases that could be going on with that intestinal tract.
Why are endoscopies important?
Great question. I think that it adds to our toolbox. Everything we do diagnostically has pros and cons about it. And so the endoscopy, X-rays are wonderful. We take a lot of X-rays, but sometimes we can't see everything we need to. And so I think endoscopy gives us another avenue to visualize the intestinal tract or parts of the intestinal tract that we don't have with other modalities. Again, X-ray and ultrasounds are great. We use them a lot, but they aren't perfect. And then it also allows us to get biopsies of those parts of the intestine that we would otherwise have to do surgically, which is again fine, but a lot more invasive. So it does allow us to diagnose and to see things that we can't otherwise, and to do things in a little bit of a safer manner. So,
what problems can be diagnosed with a dog endoscopy?
Great question. So again, diagnosed, well, often with a endoscopy, if we know there's a foreign object, we're not really diagnosing it. We're going in to grab it or try to grab it. So I wouldn't say that's a diagnosis. But when we're looking to do endoscopy in dogs for diagnostic reasons, we're looking for reasons, for diseases that cause vomiting, diarrhea in your pet, that are causing your pet not to eat or lose weight. So GI diseases, gastrointestinal diseases, esophageal diseases. When you enter the mouth and go down the esophagus, then go into the stomach, and then that first part of small intestine, you're going to see gastrointestinal ulcerations or even gastrointestinal cancers, and then or abnormalities or other diseases that may cause abnormalities of the ability of the intestine to absorb or digest your food. We can see those. Again, endoscopy isn't perfect. It's limited. Remember, you're looking in the small intestinal tract. So if things are on the outside of the small intestine, you're not going to be able to see them. But again, hopefully our other modes of imaging, again, X-ray and ultrasound would find those. So again, this helps us to actually visualize the inside of the intestinal tract, which will then give us some more answers. And again, in biopsy those. So the main ones are, again, looking for diseases of digestion, and those can include food allergies, those include ulcerations, those include other diseases of digestion, and then unfortunately cancers was what we're looking for as well too.
What will the veterinarian be looking for during the dog endoscopy?
Abnormalities of what the intestinal wall looks like. I think that's sort of the basics. When we know what the inside of a esophagus or stomach or small intestine is supposed to look like. So if we see abnormalities in color, or if there's a mass growing, or there's an ulcer or something that we see that's different than normal, we're looking for those abnormalities. We're looking to then biopsy those areas and help get us an answer to diagnose the disease that's causing the clinical signs we're seeing in your pet.
Do I need to take my dog to a specialist for an endoscopy?
It's a great question. I would say need, no. Absolutely can do that. There are veterinary internal medicine specialists that they do endoscopies probably more frequently than we do. They're very skilled. It is a skill that they have. Here at Newport Harbor Animal Hospital, we have a lot of veterinarians that have done endoscopies for quite some time, where we are general practice, but it is something we're comfortable with and something we feel very qualified to do. But there are plenty of internal medicine specialists in the area that do a very good job doing it, and we do refer to them for certain cases for reasons. But in the general cases of trying to retrieve foreign bodies or trying to get a diagnosis, we do feel that our doctors here are capable of doing that.
Will my dog need anesthesia to undergo an endoscopic exam?
Yes. Unfortunately, our dogs aren't going to sit still and let us pass a long scope camera down their throat. So unfortunately, we do need to go under general anesthesia, and then we do that, and we're able to then easily pass the scope from the esophagus to the stomach into the intestine again. Or if we're doing a colonoscopy, we're going into the colon. So it is something that we do require general anesthesia for, to make sure it's safe for the pet and for the equipment being used. Yeah.
How should I prepare my dog for an endoscopy?
Great question, Brittany. If you meet with your veterinarian and they determine endoscopy is what they recommend for your pet, they'll walk you through how to prepare your pet. But usually here at Newport Harbor, that entails, because it is an anesthetic procedure, you're going to want your dog fasted. So they're going to not eat after dinner the night before. We're going to take water away in the morning. You're going to show up at our practice early in the morning, with the pet fasted. You're going to get checked in by our team and meet with the surgical technician, who happens to be Brittany, and they're going to walk you through the procedure and what the day will look like. But really, other than that, it's pretty simple. And then at that point, we take it from there here at the hospital. Obviously, if your pet's on certain medications, then the doctor will advise you on to give those or not. So.
Will my dog need any special treatment to recover from an endoscopic procedure?
Another great question. It's pretty simple. Obviously, one of the reasons we, again, highlighted that we do in endoscopies is that it's less invasive than a surgical procedure. So they will have general anesthesia, so they'll go home a little groggy that evening. They'll have some limitations on diet that evening and exercise for the next day or two. But after that, the recovery is pretty simple. With our endoscopic procedures here at Newport Harbor, we often send some medications home for the GI tract. Sticking a camera down the dog's throat and into the stomach can sometimes irritate the esophagus and irritate the stomach and intestinal wall. So sometimes we'll send some GI protectant medication home for a few days to a week, just to make sure we treat the gastrointestinal tract as nicely as possible. But other than that, recovery is pretty quick, and that's one of the reasons we like it versus surgery. Again, it has limitations, but if we can use that versus a surgery, that's the big reason we do it. The recovery is a lot faster.